Listen in with KNN, the sports sound of the district. We bring you the biggest guests, great analysis, and the hottest sports stories in the nation's capital and beyond. And we bring it to you live. Welcome to this live stream broadcast of Listen In with KNN. Here's your host, Kelsey Nicole Nelson.
All right. Hello, everyone. Welcome to another live stream edition of Listen In with KNN, presented by Fox Sports Radio, 96.9 FM and 1340 AM. It is my honor and pleasure to welcome in someone very special to the show. It's his very first time on the show. As you all know, Prostate Cancer Awareness Month is very near and dear to my heart. It's a process that I've been involved in about 4 years now. I always try to get involved in as many community events as I can because I think prostate cancer is one of those things that we all need to learn more about. It's affected my family personally, and it's affected some loved ones personally. So I thought, why not bring an expert who can talk with us about it and hopefully help us prevent prostate cancer? Because, of course, our goal at the end of the day, one day, fingers crossed, will be to, of course, end cancer. So I am so excited to welcome in none other than Dr. Mohamad Allaf. He is the Executive Vice Chairman of the Department of Urology and a Professor of Urology right down the street in Baltimore at Johns Hopkins Medicine. I'm so excited to bring him on. So without further ado, please help me welcome him to the show. Dr. Allaf, how are you today?
I am well. How are you, Kelsey? It's a pleasure to be with you today.
I'm doing fantastic. Thank you so much for joining me and taking time out. Look, I know how busy doctors are, as I truly appreciate your time. I like to start with my guests. How are you feeling? How are you doing? I know COVID-19 and everything else that's been going on in this country has been a lot for us. So how is your well-being doing, doctor?
I would say relatively well, considering I have a newborn at home who's about 6 weeks now, baby Jude. And so we're happy to have him. I forgot about all the diaper changes and crying. But considering that and a pandemic that we're living in, that we're all, I think, trying to do the best that we can.
Yeah.
Thank goodness we're healthy and doing well. That's a lot to say.
That's what matters most. Congratulations on the new little one. You know, we want details. We want the name. What was it named after you, Dr. Allaf? Was the little one named after you?
No, his name is Jude, and it was just a cool name that we came up with. And he has an older 8-year-old brother, so a big age gap there, which should be interesting. And he's healthy and growing. And if anybody knows any tips on how to get him to go to sleep at night, just let me know, please.
Any tips? Yes, please send Dr. Allaf's way. And Dr. Allaf, it makes you feel better. Me and my little sister have a 9-year age gap, so I understand the age gap completely. But I promise it's not that bad, and me and my sister are super close. And then I also love the name Jude. Hey Jude comes to mind by the Beatles. Like, I'm not going to start singing it because I don't want to embarrass you or myself, but it's a very, very good name. So congratulations once again. And Dr. Allaf, let's get into it. I mean, September, Prostate Cancer Awareness Month. Of course, we want people to know more about prostate cancer. So I think what the listening audience needs to know let's actually break down what prostate cancer is. And then can you follow up with who's most at risk to get prostate cancer?
Yeah, so unfortunately, prostate cancer is a malignancy, so a cancer that happens in the prostate gland. So it obviously afflicts men. It afflicts men who are aging. The average age is going to be a man who's a little bit older, it is the most commonly diagnosed cancer in men, and is also one of the most deadly cancers in men numerically. But there are a lot of men who are diagnosed with prostate cancer who don't die of it, but may suffer from other things related to it and die with it rather than of it. So it's a very important public health problem, and many families, just like yours, in the United States and the world, have dealt with it and are dealing with it and will deal with it, sadly. And I think it's incumbent on us to take the month of September and every month, really, to be aware of it and to know how we can get checked for it, what we can do to prevent it, and really early detection is the key.
Yes, that early detection is key. And that's why you're on the show. We're trying to help people find that early detection. As you said, I don't want it to only be in September. I know this is the month that it's recognized, but we need to talk about it all year long. And I think something that you touched on that I just kind of want to delve deeper into is we said it affects older men more. Now, Dr. Allaf, I don't know if you're like me, but I'm 28 and some of the younger kids call me old. So let's define older men. Like, what's that age range? What's that range of men that you're expecting most of that should go get checked and see doctors like you or any doctors around the country to make sure that they hopefully don't have prostate cancer?
Yeah, so while prostate cancer can happen in men of many ages, the sort of highest risk group is going to be men 55 years old or of age or older. The current recommendations are to have a discussion with your physician about prostate cancer and how one can test it. There's a blood test called the prostate specific antigen, or PSA, that one can get. There's some rationale to maybe getting it a little earlier in life, perhaps in your 40s as a baseline, and then working towards having sort of to know your stats and see where that PSA is going and have a baseline. Okay. But the current recommendation, strictly speaking, would be to have a discussion specifically at age 55. That is, if you're of average risk. Now, if you have a family history, et cetera, I think you would want to talk to your physician even earlier than that. And I would suggest starting that conversation at age 40. And I know a lot of men know that the PSA test comes with a rectal exam sometimes, and try to delay that because they think that it's not a pleasant test, and I would acknowledge that. But honestly, it's a quick test. It's so important. And your doctor can tell a lot by getting the blood test and the exam as well. And so it's important to talk to your doctor about this.
Yeah, so it seems like have that close relationship with your doctor. I'm happy that you addressed the rectal part of it. Look, I've been to many events and all the time, Dr. Allaf, like, Kelsey, I know I need it, but I'm just not comfortable with someone being, in my private area, the rectal area. And like you said, I think it's not the most comfortable thing, but look, if it helps your health and you're having someone who's trained to do that, get it done, right? I mean, I'm sure it will pass by quickly and you just rather know to find that early detection.
Absolutely. And if it's a deal breaker for some men, rest assured, the rectal exam isn't the end all be all, right. But you can get checked with a blood test. There's now MRI and some other blood and urine tests that one can get to help sort of tell you what your risk is and whether you need to proceed with something a little bit more invasive. The important thing is to not delay, not to put your head in the sand and kind of think that things are going to be okay, and hopefully they'll be okay. But I think it's incumbent upon all of us to be proactive. Right. For us and for our loved ones, and get checked.
Yes, exactly. Your loved ones and for yourself, make sure. And I love that we touched on how the disease is diagnosed, because I think that's obviously very important. And I think prostate cancer, Dr. Allaf, is one of those, we know a lot about different types of cancers, but I don't really know if we know enough about prostate cancer. I don't know if we hear about it enough. So again, make sure that you get these things done and you go to your physicians. And I think just off of that, Dr. Allaf, if someone doesn't have medical insurance, because I know COVID-19's here, we fortunately see many people losing jobs, right? Which is just very heartbreaking and unfortunate. For those type of men who, still want medical care and to get their prostate checked, are there still avenues or ways that they can still get this done in a way that's inexpensive or for free?
Absolutely. I think, pre-COVID, a lot of places, including Hopkins, used to run screening kind of drives and things like that. With COVID, it's, I think, become a little bit more limited. However, I would emphasize to people that we as physicians have committed to taking care of patients no matter of ability to pay and insurance. And I think that if you don't assume that you will not be seen, et cetera, we have plenty of programs that would allow individuals who are under or who don't have insurance to see us. And I would think call your big medical centers, whether it's George Washington, Georgetown, Johns Hopkins. And believe me, all of them have programs and clinics that will see you and care for you well. So absolutely.
That's wonderful to hear, right? Because money should not be an object when it comes to anyone's health. So I think it's enlightening that there's programs out there for people. Then just following up on that, I think prostate cancer is one of those things, sometimes we usually know when we're sick, right? When you have a cold, you're coughing, you're sneezing. I feel like many things, we usually go to the doctor when we feel side effects or symptoms. Does prostate cancer have any symptoms like that where someone should get worried? Should they have any, symptoms that are kind of triggering to the disease?
Yeah, most men who are diagnosed early in the disease will not actually have any symptoms, and that's good. You don't want to have symptoms. Now, having said that, later in the disease process, one can have symptoms, and some of those symptoms can be urinary difficulties, pain on urination, difficulty in urination, a weak stream, frequency, and urgency. Although most of the time, those types of symptoms are related to enlargement, which happens as we get older for us guys. And so don't assume that those symptoms are cancer and oh my goodness, this is terrible, but get checked because your doctor will tell you this is probably enlargement. There's some medications for it, etc. Further along, some men can have, unfortunately, bone pain because prostate cancer likes to spread to the bone. And of course, many men have back pain and musculoskeletal pain. So again, that is not a very specific symptom, but something that you would read about in terms of symptoms for prostate cancer. So the average man today comes into the office, gets checked with the PSA test. If there is a elevation in the PSA, that does not mean that they automatically have cancer. It just means there may be something going on in the prostate. Enlargement, inflammation are much more common.
Right.
But of course, we then have a red flag that's been thrown through the statistics that we've sort of uncovered, that we now need to do a little bit more uncovering. And what follows the PSA test is some confirmatory, either blood or urine tests, maybe an MRI to look at the prostate in a little bit more detail. And then ultimately, for those at highest risk, where all these tests are indicating something's going on here, we would do a biopsy where we would put needles into the prostate to get samples and prove or disprove that there is prostate cancer. And then we go from there in terms of treatment options.
Perfect. So it's great to know just those different factors that are out there. And I think when you go on that, we kind of talked about the more advanced stages of prostate cancer. Can you talk about the different stages of prostate cancer that there are?
Yeah, so all cancers have a stage 1, 2, 3, and 4. But just broadly speaking, there are those cancers that we catch early, and we call them clinically localized. And they could be in the prostate or maybe just a little bit outside of the prostate. And in general, the treatment options for those types of cancers are, believe it or not, sometimes doing nothing, something called active surveillance. So not all prostate cancers need treatment. We know that some of them are pussycats and some are tigers. And for the pussycats, we would know, listen, there's an early cancer. It may not harm us in our lifetime, and we have ways to watch it. So we're just going to keep an eye on it. And if it turns into a tiger, we'll get it before it does that. For the ones that are more tigers, it's going to be either radiation therapy or surgery. There's lots of experience in both of them, and today's side effects are a lot more tolerable, I would say, than they've ever been. And then in the advanced stages, when the prostate has left the pelvis, let's say it's in the lymph nodes, it's in the bone, that would be a more what we would call metastatic prostate cancer, stage 4 cancer. But even in those situations, it is not like a lot of other cancers where, oh my goodness, we have 6 months to live. I mean, nothing's 0 or 100%, but in general, we have a lot of treatment options that can keep life functioning with good quality of life for sometimes many, many, many years. And we're certainly always working on a cure. We know the early ones we can cure, the late ones we control for a long time, but we are working on some ways that we can even maybe cure those today, which is very exciting.
That's very promising. It brings a smile to my face because, of course, that's what we want. And Dr. Allaf, I'm just curious, from your time at Johns Hopkins Medicine or just your times as a medical professional, what are some of just the biggest misconceptions that you've heard about prostate cancer that you wish that you could just, zap away from the human brain?
Yeah, I think some of the big misconceptions is the relationship of cancer with erections and sexual function, really that there is, men may suffer from some erectile dysfunction. It has nothing to do with cancer, and there's maybe a stigma there. Right. There's also the idea that if you have cancer as a man, that all the treatment options leave you sort of less of a man. That there are side effects such as urinary incontinence, leakage of urine, sexual side effects, things like that. And while those do exist, I think that if detected early, and again, that's why we emphasize early detection, today's treatment options can maintain a lot of those functions. And you'd be surprised how many professional athletes, captains of industry, et cetera, have had prostate cancer, have had it treated, and are move on with their lives and have great, healthy, fulfilling lives with their families.
And that's what we want, healthy, fulfilling lives with their families, right? That's what most people want, just to live that American dream. And I think just on that, Dr. Allaf, if you could, do you have any just positive success stories of a patient that you treated? I love to end the show on just a happy note. I know I'm putting you on the spot, but I think that would just be so inspiring to hear.
Yeah, I mean, it's always disheartening to see somebody, walk in, with children in tow, having heard a story that, they have prostate cancer, they hear the word cancer, they have a young family, young wife, and they really think that this could be the end of the sort of line for them. And they start to see their mortality and come in not in the best state of mind. And I think, recently, I had a patient just like that, and we, the key is to sit down with them for someone like me, educate them about the disease, empower them, because knowledge is power, and put forward all the options. And we selected the right option for that individual. And I would say he didn't skip a beat. He did well after surgery. His PSA went to 0, which means that he's hopefully cured of his prostate cancer, and functionally he's whole, I would say, and doing great. And so, those types of stories, and they're not uncommon, thankfully, and that's what makes me go to work daily is that we see those types of stories, and for me are what make it all worth it. And
that's what it's all about. We got to keep doctors like you in business. We want those success stories and just doctors that we can form relationships with. So I really appreciate you touching on that. And last but not least, because we've said all of this great information and just layman terms, what do you think people should most take away knowing about prostate cancer after this interview today?
Yeah, great question, Kelsey. So, I would, risk factors for prostate cancer we didn't cover. I should just mention them. So obviously, aging males, those with family histories, in particular first-degree relatives, and African-American men. We don't quite understand why African-American men are at a higher risk. And when they do have prostate cancer, they tend to have more aggressive cancer than their Caucasian counterparts. And part of this could be biological, but it also could be related to disparities in access to care and disparities to care, which we as a society unfortunately struggle from, and we're trying to bridge that gap. So it's important to keep that in mind. And then knowing that there are some simple ways that one can get checked for prostate cancer, and some really good and effective treatment options today. And I think if you take those take-home messages, and for the ladies listening also, that they need to usually, and usually I think the women in our lives tend to be sometimes a little bit more proactive about things like that, and I would have that dialogue with your loved one, your male loved one and partner and what have you, to make sure that they're getting checked and that they're aware of and are educating themselves about this.
Yeah. Such good knowledge, Dr. Allaf. Such a pleasure. And I agree, because I'm one of those women that anything's wrong, I'm going to the doctors. They probably see me more than they need to, but I'm always like, let me just stay safe. Maybe it's better though with that mindset, right? You just want to stay safe. So again, I appreciate your time so much for being on the show. And if anybody wants to connect with you, any contact information, if they want to switch doctors or get advice from you, where can you be reached?
Yeah, so one can call 410-955-6100, or you could email me, mallaf, M-A-L-L-A-F, @jhmi.edu, and we would be happy to help with whatever it is that we can help with.
Perfect. Dr. Mohamad Allaf, thank you so much for joining me. We'll let you get back to your patients and your little one. Truly, truly, truly appreciate your time. Thank you so much.
Kelsey, thank you. And thank you to the audience. And I hope we do this again soon. Take care.
We need to. Thanks so much. Please don't be a stranger. Have a great one. All right, you guys just heard from Dr. Mohamad Allaf. He is a doctor at Johns Hopkins Medicine, an exceptional doctor, also, again, the executive vice chairman of the Department of Urology, and also, yes, a professor of urology. So thank you so much to him for joining us again. Listen In With KNN is committed to making sure that we all know about prostate cancer, and what better time to do it than September, which is Prostate Cancer Awareness Month. Please, if you love your family, make sure that we're keeping them healthy. Again, early detection is key. If you don't take anything else away from this program, early detection is key. And please, Dr. Allaf, his contact information, please, please, please feel free to reach out if you have more questions that we didn't get a chance to answer on the show, or if you want to talk to him one-on-one with your personal questions. As always, thanks so much for joining this special edition of Listen In With KNN. We'll see you next time. Have a great one. Bye-bye.
Follow Kelsey on social media at The Real K Nelson, and catch each broadcast of Listen In With KNN on air at AM 1340 and 96.9 FM Fox Sports Radio, on YouTube, on Facebook and Twitter, and online at KelseyNicoleNelson.com. Thank you for watching this special live stream broadcast of Listen In With KNN.